Sorry,
Sorry,
just recording on, that's fine. Contemporary issue, well, it's something which surrounds you very recently, and if it's a very profound health matter, then it would possibly relate to a period slightly sort of starting slightly further back, but possibly still be relevant. A matter which is a health issue which is not completely sorted out, a matter which is being hotly debated as a very imminent, very serious but imminent change. Those kind of things.
I think I agree with that. What I would probably just add to that would be, these are issues which we kind of identify maybe on a day-to-day current basis, and the idea of looking at these issues these are burning issues or issues which have implications and some sort of an applicability in terms of having a direct or an indirect impact over a period of time. And that is where some of these need to be looked at within the national healthcare policy, so that they are not the burning, or they are not as burning issues as time goes by, so that they are in a resolve, to a certain extent, they are resolved in a way wherein they do not become issues. So in effect, yes, I think kind of agree on a ballpark. There are lots of definitions of how we define contemporary issues. But I think in general, this is an area which basically is quite a vast area, but it encompasses issues which are in general related to the workings of the health sector in particular. It could be environmental, it could be physical, social, emotional, whatever it is. But these are issues which are kind of defined from that aspect of understanding that these are things which occur, and obviously they kind of lead to a situation wherein they need to be looked at the policy level, at the governmental level, and in some cases, as we go along in some of the slides, we'll discuss, what are these issues and obviously how they are classified as contemporary issues. This slide kind of summarizes what you've rightly said. What I've put some points in is there are health issues referred to current or occurring topics or situations in healthcare in particular, or health in general. These include issues such as hospital care standards, elderly care funding, and government cuts, which are amongst others, specifically in the context of UK, when we look at NHS England in particular. And in order to study them, we sometimes also look at the role of promotions, which we've covered, I think, last time, in terms of promoting healthcare, and in terms of what information provide and how reliable and how valid that piece of information is, and how should the public actually look at reacting or consuming that information, so that they are understood correctly as contemporary issues or issues related to healthcare. The next slide basically looks at there are lots of issues. So when we look at healthcare, the definition of contemporary issues totally changes. So the idea of having this slide here is to kind of clearly differentiate that the context of what we are looking at is actually in the implications of how healthcare management or healthcare services in general are managed within the NHS England. So this particular chart here, or the diagram here, actually shows what are the issues in healthcare management. And some of the issues that we classify are classified as strategic, as the funding issue, and because of which there's a review being undertaken in 2018 for 2018-19 to look at properly funding NHS and NHS services, including healthcare, mental care, and other stuff. There are issues related to human resources, operations. There are reforms which need to be put into place, and then there are quality management issues which the CQC in particular looks at, and the reviews that they do over a period of time with every trusts or the CQCs, the PCTs, sorry, and the new form of the PCTs, which is basically the trust. So very briefly on the left hand side, what I've done is put some context in terms of when we look at NHS England in particular, we have looked at there has always been a keen focus of improving efficiency, operational efficiency in terms of NHS, whether it's the the recruitment of doctors, nurses, the right kind of care available, patient to doctor ratio, the patient to hospital ratio, things like that, which are all under the operational efficiency. There is also this has been identified by one of the research studies which are put towards the end in this presentation, is where Jeremy Hunt, I think a couple of months back, was pushing with the idea of having 7-day GP surgeries in order to kind of streamline the appointment system and then make some of the services related to mental health care, the first response of that to also happen from GP surgeries. So again, this point is related to reforming the healthcare system in general, which is provision and how it starts off from the NHS, in the NHS, from GP surgeries onwards to hospital care and other things. Again, in the recent news, there was the big headline of rogue lawyers, fleecing money from the NHS, which was to the tune of which actually comes out of litigations and legal costs in particular. So those are essentially related to quality issues in terms of not proper care being provided, or errors happening in the medical care, which lead to patient safety concerns, the next point, and those then lead to some sort of legal implications for the NHS in terms of people kind of suing up because they've not received the right treatment, or there have been deaths and things like that as a result of the treatment. And we also look at the provisioning for, strategically, we also look at the provisioning for new diseases or things which have to be provisioned in NHS England, and in particular this is directly related to the money being spent on research and development along with the private companies, in particular the pharmaceutical companies, to try and bring out new drugs, the testing of those new drugs, and obviously those and their applicability in terms of availability within the NHS over a period of time once they've passed the clinical test conditions, or they've been approved. And lastly, the finance and budgeting, which is very important at this stage to be able to provide services, is also an issue. And as we live longer, this is the point that we've looked at earlier, that what it says is if it continues like this, then we'll have to privatize NHS by 2030. This is one of the studies which comes out wherein increase the delivery of some of these services within the NHS has to be outsourced to the private sector, which a lot of groups are opposed to. And that is why a financial review, I think, is probably going to be conducted next year as per the King's Fund's website, to look at properly funding NHS, to manage and provide these healthcare services. So these are all contemporary issues, but they are issues from a management perspective. So what we are looking at doing in this particular learning outcome is we are going to differentiate and study these issues from a perspective of understanding them from healthcare services perspective, and also just this one slide to give an idea that, okay, these are the issues as identified on a macro level from a management perspective. But I think we'll be going into much deeper when we look at some of these issues from the services perspective, which is what we want to be able to look at, for the learning outcome. Yes. Is that okay?
That's absolutely fine. Yeah, I was just seeing the penultimate statement on the left, and then the new diseases, and I couldn't help but see on the TV this week Rory Bremner, the imitator, the comedian imitator, who he's going through his diagnosis of attention deficit and hyperactivity disorder this week. So he's got ADH this week, and then there was an article on Look East about a lady described as just being diagnosed as autism, when in fact I wrote into Look East because I said you mean autistic spectral disorder, because she's so mild she could have only had Asperger's, and you should use the word autistic spectral disorder. But everyone's expanding the definitions now and putting everyone to it when they never used to have problems in their 40s.
And yes, some of these, I think I would kind of put it this way, that some of these have been probably present as issues or disorders, in the society, but because as we have now begin to, kind of diagnose and be more kind of, understanding towards these, that is where some of these, new types of disorders, diseases are actually coming to light, wherein they need treatment because people are living longer again, and the modern lifestyle kind of puts these pressures, has created some of these, or probably invented some of these new disorders and diseases. Also now, in terms of the NHS now needs to look into, in particular, I think when we look at developed countries. So yeah, that was definitely in the news. I think we caught up on the BBC as well, I think a week back. So that's absolutely fine. On to the next one, the next slide. Just looking at very briefly. Now, this is how we look at. There's a lot of coverage of the NHS, about the NHS and the services it provides in the media, and the media essentially plays a very important role in terms of highlighting some of these issues, which then are picked up by public, and there are open debates or discussions which happen, and there are people or groups which basically then contribute towards the firming up of the aims and objectives, specifically for the the NHS trust. Looks at getting opinion and gathers this opinion through various routes like surveys, questionnaires, and public debates. Now, the idea of putting this slide here is that at some point in time, what we need to look at is there are a lot of exaggerations which happen in the media, and that is where sometimes some of the discussions which happen with the public, and when public consumes the information related to National Health Services, needs to be looked at from a point with a pinch of salt. That means they need to look at where these issues are coming from. Is there some sort of a merit in these issues? And obviously, how much of these things which are discussed in the media should have actually an overall impact on the formation of policy within the NHS. So there was something which which was kind of publicized quite heavily, I think, in the early 2009 to 2010, when there was an incident wherein there was ongoing discussions between the government, and a lawsuit erupted, wherein a unit of Novartis, was paying actually a lot of money, in particular, to prescription of certain types of drugs which were manufactured by this company. So this particular case actually happened within the US, but it had repercussions, with regards to the media covering it, and to some of the pharmaceutical companies which work very closely and contribute towards the services within the NHS also were affected. So, for example, GlaxoSmithKline was affected, AstraZeneca was affected, and there was an investigation which kind of came across, wherein the parliamentary committees, commission actually called the executives of these companies to come in and discuss that, does this particular revealing fact, which was picked up with a company in the US, has any bearings within the pharmaceutical companies, when public and private sector works very closely to provide the NHS or the National Health Services in the UK. So again, looking at just the understanding of role of media, how it publicizes, picks up, and prints some of this information, which has an impact on the development of policy. So here, the word is the main focus is on caution, so that some of these issues and outbreaks which are reported needs to be looked at. They need to be carefully consumed, carefully considered before they are actually looked at the policy level. Is that okay? Any comments on this side?
No, that's fine.
Okay. What we also look at is an example that some cases, when you look at information which is looked at, there are lots of citizen surveys which the NHS does. So there was one report which was published, I think, in 2007-8, which talked about that the minority communities in the UK do not get the same level of care in the NHS as the white or the other the majority population in the UK. And this was a report which was then published and published and shared in the House of Commons, which basically, I think, as per the 2000 census, when it was done, said that the minorities, which comprise of about 4.6 million people, did have a higher fatality rate when it came to surgical treatments or treatments which happened within the NHS. And then at some stage, the validity of that information was questioned, and the Parliamentary Commission, which looks after reviewing the healthcare services, actually debated this information and came to a conclusion that this was not reliable as reported by the media, and the facts and figures were then compared. So, in terms of policy formation, that is why after that particular report, what they look at is the media has a responsibility to report some of these issues, which are, which could be contemporary issues, but when they report it in the national and international context, they have to be, reviewed before they are published. And in some cases, some of these issues, are reviewed by political, I would say parties, or not political parties, but from a political angle. They're also reviewed from a religious angle. They're also looked at being reviewed at the government level, and also some of the pressure groups, which work in particular with NHS, which review it before such information related to, data is published by the media. Is that okay?
Yes, that's fine.
I think what I will do is I will when I send you an email, point you in that direction, just to briefly look at if that's of interest, the report which was actually published, and why this then became a burning point, and reliability and validity of media information was requested by the Parliamentary Committee to say that before you report, this is what it needs to go through as a review, and before it is published in the media, it needs to go through this particular review process. Now, sometimes you get to see, looking at some of these issues, policy formation as well. Now, in most cases, some of these issues which become, some of these issues could be national and international, and when they reflect, or become issues in a particular geography, sometimes the governments, and the various agencies have to synchronize their response to the outbreak of such issues across geographies. And that is where I think the pertinent one that I would mention is the nurse which was diagnosed. A lot of British staff from the NHS had gone on to help out the Ebola outbreak, which happened in Congo and I think in West Africa last year. And there were a few members of the NHS staff which were caught out, in the sense while they were offering their services, they were caught out in the sense they also were diagnosed with having the Ebola virus. And that is where a coordinated response then came across, because it was not an issue as far as UK is concerned, but because the NHS staff was actually working and helping in countries wherein there was an Ebola outbreak. When they traveled back to the UK, obviously they brought the virus in. So a lot of response which was, put together by the agencies, nurses, or, the NGOs which were working, and where the nurses were actually going out to, help out in West Africa against the outbreak. They had to then work in coordination and in tandem with the government to be able to implement a single-handed response to contain the spread of this virus. So sometimes the point that I'm trying to make here is, when you look at the impact on policy, some of these issues are local, and some of these issues are national, some of these issues are international. And sometimes what you get to see is a lot of the response which is put together, it happens because the local, national, and international agencies come together to be able to put together a coordinated response to tackle that particular situation. And that at some stage then has an impact on policy formation. So things like the kind of suspension of flights between UK and West Africa, or people coming in from West Africa. There was a screening put in place specifically during the Ebola outbreak which happened, and then that led to minimization of repercussions for say people within the UK when it came to the Ebola outbreak. And an example that can be looked at, when we say emerging countries or developing countries, what we look at, example, dengue fever, for example, which is something which spreads to a mosquito. Mosquitoes are then identified, or the Zika virus, for example. I think during the Olympics, which was quite wide in Brazil, leading to the outbreak of Zika virus and how it was contained and stuff like that. So, those are things which have an impact on the policy formation, and the governments will have to look at, or they look at this particular outbreak in a particular geography internationally, but then have to look at bringing something into their policy so that these kind of things can be addressed first, avoided, and then if they are detected and, if there is spreads and they are contained, then, there's a response mechanism which is in existence to be able to counter that outbreak. I think the what we are seeing on a long-term basis is primarily the effect of obesity, smoking, and alcoholism in more developed countries like the US, UK, Germany, France. Obviously in terms of this, and that is where you get to see a lot of healthcare promotion campaigns are being put together, and they are becoming a part of the policy, part and parcel of the policy which the NHS now firms up every 2 or 3 years to try and address some of these problems, which and keep aside money and budgets and provisions so that they are then dealt with within the National Health Services in the UK. Is that clear? Is that something which makes sense?
Yes, that's interesting. I didn't know about. I'm interested in the single service for the elderly. That's interesting, but I still hope that the new vaccine for the new vaccination that's supposedly 100% effective and 100% safe, although I've never heard of such a thing, for Ebola. I hope that the new Ebola vaccine does get the Nobel Prize for Medicine, because I think it should deserve it.
I think I'm right. I'm not too sure if I'm correct. It's which was created by a number of people working within which was a Canada, which has been successful with for that. When the trials happened last year, I think in December. I think it's a Canadian vaccinated.
It may well be. I mean, I only caught a drift of it recently on the news again.
And it's just, I think, a passing thing which we've obviously, I think I've seen it definitely in the news. Yes, it is something that we actually had. I think it came across sometime last year in October, November, December. But the clinical trials of that particular vaccine only happened in West Africa, and it's so-called, it's saying that it is, as you're saying, 100%. Yes. There was a bit of doubt, but yes, they claim that it is 100% effective against the virus. Now, that's coming to obviously having some perspective. Let's look at it from the perspective of NHS England first. What are the 5 top healthcare issues that have been identified by this survey, which was done by HealthWatch Network? And they identified 5 key areas or issues which kind of are affecting the NHS at this moment. And one of them that came up, the top one which actually came up, was the mental health services. And access, and it talks about access to and the quality of mental health services has been raised as a priority by more than half of the local health watch. That means this was the number 1 issue which was picked up with the survey and the research that they did as far as NHS England is concerned. These are listed them down, and there's a bit more detail which can be read across from where I picked the information up from, and I put together in the last, in terms of the website or the article. So just briefly, the primary care services that we look at, in particular, the access to GPs, the NHS dentists, the access to hospital care, and after, surgery care. Those are some points which was, picked up. So look at these issues, just briefly highlighting them here. Social care services is also an issue in terms of including the quality of care. And some of the suggestions which were then put forth, I put across, here in the slide sorter notes, which you'll be able to go through. So there were things like there were suggestions that some part of this initial response to mental health services start being at the research. For some kind of one. And the other 2 points are basically looking at this is working better together, and then hospital discharge, in particular after the surgical or the operation and other things which people get treatment for at the hospitals. So these were the 5 big issues picked up by the national, the healthcare watch in particular. And then we also look at some of the same issues, but a very different perspective when we look at Brexit in particular. And they identify the issues which are slightly they are staffing, which is talking about, things like if the NHS employs currently a lot of EU staff or staff from the EU, and there are 55,000 such, the combination of staff between doctors, nurses, and midwives and stuff. And if they are to leave, it will create a serious staffing issue, and that will become a burning issue as far as, the national health services are concerned. Now, the second issue which was identified was assessing treatment here and abroad. So as you're aware that, when we travel abroad, we also have access to something called the European Health Insurance Card, EHIC. And in cases if you need treatment abroad, then if you have a card like, if you are a member and you hold a card, then you're able to get healthcare services within that particular country, say for example in France or Germany, and then that can be claimed back, by that hospital, with costs either subsidized through the EU or from the NHS with regards to patient care. It covers only certain set of services, but yes, as far as EU citizens are concerned, as far as British people are concerned, we are concerned, we get full, care under this particular access. So this is a number 2 issue after the Brexit, which was identified that if I'm holidaying abroad and I need, healthcare, or I need healthcare services, then how this will affect. And a certain amount of discussion was the discussion of immigration, which is putting pressure on the national services, and that is where I think they've introduced this surcharge now, that anybody who's coming across and wants to access services in the NHS while they are visiting as a tourist, studying, whatever it is, will need to pay some sort of a surcharge to get these services from the NHS. So that was restricted to the implementation of European nationals, because we get our services vice versa when we travel to Europe under the EHIC scheme, which is which allows us to get during our temporary stay healthcare services in that country should we need them. The third issue was regulation, and this is, I think you would probably about this, is that the directive which looks at the 48-hour limit for doctors working with the NHS in terms of GP surgeries, and that's a regulation which might be repealed once we exit the EU. And there are varying opinions and perspectives on this in terms of does this regulation help, does this regulation not help, and will it affect the national health services in general if this particular thing is repealed? Because it is currently under the European EU regulations that it is implemented in the NHS for doctors. Are you aware of something like that?
The only thing I heard that Theresa May had said before sending the final letter for exit a few weeks ago, that she'd already said that she wanted to enshrine EU law in British law, and only allow changes to be made, almost giving all the EU laws British title, but then and accepting all of them and asking for them to then be adapted and changed or struck out, not that they would be dropped, that they were supposed to be enshrined in British law. But of course, now we've got a general election. You can't say who's going to do what with anything.
Correct. Yes, there are lots of what I think there are opposite strands which are coming across from Theresa May and Jeremy Corbyn. So things which she is promising or she has put some sort of a question mark on, they are kind of being firmed up by Jeremy Corbyn as election pledges, or by Labour Party saying we'll honour these, and if you elect us and things like that. So yeah, it's all up in the air because of the general elections. Yes.
And even I mean, I think I expect the Liberal Party will say that they're prepared to share power with the Tories again, or Labour, in which case they might have a critical influence slant either way.
Yeah, I think so as well. I think it will definitely. This is a point to ponder, and I think people before they vote, they will actually consider some of the things which are being set out in particular by Labour, and for those, it gives them, it gives a bit of a fire to the thinking which some people have, is that okay, the Tories are getting away with it, and it has given them a chance to now look at putting this into a perspective when they vote. Is should we just blindly go ahead and vote Tories, or should we look at giving Labour a chance, because some of the might be beneficial in when we look at again the basics of some of the things which they are trying to reverse. So I think my gut feel is that slight bit of digression, but my gut feel is that we'll have a rise in taxes definitely, and rise in VAT by at least 1%. If Tories are to win, and this cost is finally going to be borne by by us as against the politicians. So they whether we get Tories or Labour, I think this is something which remains to be seen, that who will come clean and come kind of true on their pledges which they're kind of setting out right now. No rise in national insurance contributions, but because there's a general election happening now, and if they get the mandate again, then it kind of reverses what David Cameron had promised when they won the elections last time. So yes, kind of a double-edged sword at this moment in terms of where it will go, but yeah, it will be an interesting inflection when we look at with a bit of hindsight once the elections are done and see who actually wins it. Right. One or two other issues that we will look at very briefly is, the fourth issue which has been identified is cross-border cooperation. So currently, there's a lot of cooperation which happens within the EU in terms of budgeting for the NHS. And I think what I picked up from the Office of National Statistics is that there is, 5.4 million euros which are invested every year, or contributions made by EU in particular to the NHS R&D budget. And that is, that is finally going to go away, but not in the immediate future, because some of these things before we exit will continue. But it's again an issue which needs to be looked at from a policy perspective. When they try and firm up something in 2018-19, when we are closer to a divorce settlement with the rest of the European Union, that is where again this particular issue of cross-border cooperation will have to be looked into, either from budgeting perspective internally, or to look at an example of N1, the bird flu pandemic. If there is a coordinated response required, currently it all works seamlessly, because we work within the regulation to kind of work with some of the other agencies and countries to maintain this. But in the effect of when we go out, how will that work? And those things will have to be put into again policy formation to offer these services. And last but not the least, fund and finance issue in particular, which talks about the whole campaign, the bruising campaign, which is run, that we'll have more money to be able to spend into NHS, and the big headline on the bus with Boris Johnson and some of the others when they campaigned, they clearly said that if we leave the EU, we'll have about £350 million more available, a week to be able to invest into NHS. which obviously, a lot of the politicians have now distance away with currently. But yes, that led to, the formation of a spending review, which is now in place, and it's currently slated to happen in 2018-19. Which Jeremy Hunt has kind of, put in place, and this is going to be happening so that the NHS is properly funded and there is enough funding available to provide all types of services, whether we look at healthcare, social care, mental health care, services for elderly, and, other ancillary services related to, the National Health Service in general. So this is the first issue that, has been identified. So there are two perspectives. One of them in terms of identify health watch, the other issues which are identified which are more closely associated with just Brexit, which have been compiled only I think in only last year in November December timeframe. Last but not the least, I think just two slides very briefly looking at on how a practical or a coordinated response is actually put in place when we look at some of these contemporary issues from an international perspective. And I think going by what has been indicated, what has been presented in the indicative content, which is the example of AIDS, is something which I've kind of focused on and put something in perspective here. Is AIDS, for example, in particular, when we look at that is where what we've seen is there's a lot of significant spend which has been happening, to contain this virus, to contain the spread of, which is done through educational campaigns, promotional campaigns in particular. And there has been the funds being made available, have been using in particular, for this particular virus or the spread of this. Things in perspective, there were about 32 million people in 2005 for the survey by UNAIDS, and that has kind of more or less more than doubled by the end of 2015. So obviously this is still spreading as a problem, and there is a global coordinated response which is required to be done, and there are some implementations of that is what we get to see in certain countries. Put that across, for example, which is a destination. The country issue there is that it is a destination from a point of view of, is where a lot of cases for HIV in 2005 and 2010. So the international organizations like UNAIDS, UNESCO, World Health Organization, and a lot of other countries is in order to provide money and resources to stop the spread of this particular condition, they have worked in tandem and in some organizations in Thailand, Government of Thailand, and they did a campaign which was basically looking at raising the awareness and also the distribution of free condoms, in terms of the program, under the literacy program, to increase the awareness of this particular disease that is non-curable at this moment. There's no specific cure for this, and certainly leads to fatality, over a point in time. And this has helped campaigners and the coordinated response from the international community to this problem in Thailand has reduced the number of cases, drastically after 2010, and so it's been effective. That's how you look at maybe this example, how maybe the policy at the international level, when we look at organizations like UNESCO, we look at organizations like World Health Organization, UNAIDS, worked with some other charities within UK like Oxfam, which have contributed, heavily to the propagation of literacy and also the, free advice and program available in Thailand, leading to a reduction, more than 74% reduction in such cases being diagnosed now after 2010. A simple example is in Uganda, again, to reduce in the and in particular the HIV across this particular belt in Tanzania, and again due to a coordinated response which has been put together by national, international, local agencies in order to spread education, spread awareness, and then make people more aware of how they need to maintain personal hygiene to avoid these kind of transmitted diseases, which then has reduced fatality rate. But in spite of all this, what we've still seen is that the number of cases of people being diagnosed has risen from 32 million in 2005 to 70 million towards the end of 2015. So it is still doubling, and there is more which needs to be done in order to, contain some of the spread of these diseases, specifically in the underdeveloped, developing, and emerging economies. Now, there are some. So obviously, we understand the problem, and what are the areas or what are the steps using which we can actually look at preventing this, and what are I would say steps which have been put together at the policy level, which have been agreed on as an international agenda and now being implemented with the help of various agencies and organizations is actually highlighted here. So how to look at prevention of HIV, for example, is stated across in these points which have been agreed now internationally by all major organizations, and that is where the collective use of fund is happening. And then if there is a shift or any change required, then it is done at the policy level before it is implemented, at regional level or at the local level. And some of these points include, high level of political leadership. That means it's an issue which needs to be highlighted at the highest level, at the highest comment level, at the national department, healthcare department level in various countries. There is active engagement, by various sections of the society, various people in the sections of the society. This could be religious leaders, it could be, focus groups, it could be people which have, a key role or a dominant role to play in the public life. They have been, asked to kind of endorse and become ambassadors, which also looks at, spreading the news and information or education about this particular issue. There are other areas which have been looked at, things like free promotion of, devices which help contain this, personal hygiene, and, things which are programs being put together by, various NGOs at the level try and contain the spread of this particular, let's put it this way, this particular disease in, some of the economies or some of the countries, specifically in Africa, or in countries wherein there is very low education about the whole idea of this particular condition. Now, so just to summarize, I think what we've looked at today is this, the issues in healthcare, how this is slightly different from contemporary issues in healthcare management. But overall, when we look at both the topics together, there is a difference in terms of the issues, because some of them are looked at from the management level, and some of them are looked at from the services level. We briefly looked at the role of media, the information they are able to, and the role they play in terms of providing to the public in general, the various peer groups, pressure groups, or other groups which basically look at consuming this information and then look at using this as a starting ground to have starting ground to look at forming policy. Now, what is the impact of policy, and how some of it is created, discussed, have been looked at. There's a combination of some of these having some of these issues being local, regional, and international. And some of them sometimes have to be combined from a perspective of looking at having an impact of the policy, and that we've covered to an example of looking at the Ebola outbreak, or the H1N1 bird flu outbreak, or some of the modern other day problems, which is the government looking at curbing the use of sugary drinks and other things which is leading to things conditions like obesity. And then what we've done is we've identified the issues from two perspectives. One perspective of the surveys done and the vote, and how King's Fund actually looks at it from the NHS. And then lastly, but last but not the least, looking at the response, which is put together, on an international, national coordinated basis to deal with some of the, epidemics, most, kind of conditions, to try and improve it across so that they do not have any, any repercussion on, say, for example, people in the developed countries. Is that okay?
Yes, excellent. Yes.
So this learning outcome, I think is a bit of an extension into understanding how promotions work and the areas to identify the issues and how the promotions has been, propagation of these issues, how the media and what role the media plays in terms of, helping to form a policy at this level.
Could I just say that I was hoping to see the final slide 16. I don't know whether it flew by. I don't.
It's basically the references, the additional reading from where I picked up the data, in terms of the key 5 issues. So those are the things which I put up here, just to look at some additional reading.
Right.
Is that okay? So what I'm going to do is, obviously, towards the end of this session, I'm going to send you a copy of this presentation, and then maybe the additional handout which I mentioned to you about, to look at this in a bit more detail, because I think what we've done is we've just scratched the surface of looking at some of these issues on the PowerPoint presentation. But in order to get a little bit more deeper understanding, that particular handout will be helpful, to put some more details on what we've discussed today.
Okay, well, I've got a legendary division handy notes book, which is just basically file paper in a book, and I have made my own notes on 1 to 16, but they're a little bit briefer probably than your slides.
Okay. No problem with that. Any questions, queries, which kind of originate from those notes, please email them to me, and I'll come back to you with some additional information.
Thank you.
Good stuff. Anything else before we close the session?
No, I think that's okay. I mean, the only thing I wanted to know whether the NHS and Parliamentary Ombudsman still had jurisdiction over the London Deanery, because they seem to say not. But I thought under the picture on the diagram they did.
I have to investigate that. I won't have an answer for that, to be honest, at this moment. But it's definitely the issue that we discussed in the previous year. The structure of the national healthcare under the learning outcome 3 that we looked at. Are you referring to that, or?
Well, no. Well, it is because it's a complaint about. It's to do with how I progress with what I would need as general practice refreshment, but there's quite a serious complaint within it, and I wanted to know if where the complaint went, and what happened was the Academy of Medical Royal Colleges wrote on my behalf to the Royal College of GPs and then to COGPED, and then they said the answer lies with the London Deanery, but we're not prepared to help you go any further with the London Deanery. So I wrote to the Ombudsman, and the Ombudsman said the London Deanery are not an organisation I can deal with. But according to the diagram, it looked as if they were. So I just feel as if I was being dead-ended down a T junction, thinking it was a road.
Right. Okay. Got that. Understood. So so in terms of, obviously, yes, you've gone across to the Ombudsman. So have you looked at resolving it, or is that something that you're still looking at resolving it through a different route?
Well, yes, indeed. I mean, it may get that. I'm up for the GMC. The GMC have just started my review, so I've got another hearing to see what my conditions of practice should be for August 2017. But they've asked the assistant registrar to bring it forward. But we're waiting to see. We wait to see what's happening. I've made a stink there because at the moment I've got 12 conditions online and 12 public conditions, we've also got the GMC Bible out, and it says that a doctor shouldn't have more than 5 conditions. So I've made a complaint to Standards and Ethics, and they've asked the assistant registrar to bring it forward. So I'm sort of rather got two or three issues going on before I get whether I get assessed accurately and adequately to allow me to refresh in general practice or not. The thing is still up in the air, and no doubt they will ask me whether I am making progress with you in this qualification, whether I'm succeeding and being healthy at work and play myself at the moment, you know.
I understand that, not a problem. I think some of these reviews end up, they take their own time, and they kind of tend to follow their own path because of the complexity of the organization that you're dealing with, I guess. So time frames is very difficult to predict, but hopefully that should come to to come to some sort of a resolve as far as that is concerned. So I'll leave it at that if that's okay with you.
Super. Thanks a lot, Ram. Thanks a lot.
I'll catch you, next week. Hopefully, if I can get some, tentative dates for the next 2 weeks, as you mentioned earlier.
I will. I can do that today. I'll let you. I'll email my date, my no dates over. Yeah.
That's fine.